This Monday, I'm Dr. Peter Glidden, your friendly neighborhood naturopathic physician, helping you to see the light of good medicine. You know, good food, good dog, bad dog, good medicine, bad medicine. Most of the medicine that's practiced in the United States in the 21st century is bad medicine because it's practiced by MDs who are trained in a reductionistic, pharmaceutical-centrist, for-profit philosophy of medicine, philosophy of healing. There's nothing wrong with making money, but when you add a for-profit money-making juggernaut to a monopoly, the only people that win are the people at the top. In this case, it would be the doctors, the hospitals, the insurance companies, and, of course, let's not forget the drug companies. The biggest thing that we have to overcome here in the United States is our steadfast, unquestioning genuflection at the altar of the MD. I don't know where it started. I don't know how it started, but I'm here to put an end to it. Your medical doctor is the leading cause of death in the United States, and while your medical doctor has monopolized the theater of medicine in the United States for the last 100 years, obesity has skyrocketed, Alzheimer's has skyrocketed, kidney disease has skyrocketed, high blood pressure has skyrocketed, unnecessary surgeries have skyrocketed. Our life expectancy has gotten worse. Our birth rate has gotten worse. We are going to hell in a handbasket because we've taken the wrong dog to the hunt. We go to MDs because that's the only game in town. It's the only doctor we know. We just assume that our MD knows what's best for us, but our MD does not know what's best for us. Your MD knows what they've been trained in, and what they've been trained in is one small aspect of medicine. And, you know, it's a free country, and, you know, it's a free world. Well, it's a free country. There's room for everybody. The problem with the MDs is, the problem that I have with them and why I hit them so hard is for the last 100 years, actually it's been longer than that, ever since they've been around, they have gone out of their way to keep all other doctors, all other physicians, all other medical points of view out of the mainstream. Out of the mainstream. As a licensed naturopathic physician in the state of Illinois, I can't practice medicine, and if I tried to, I'd be thrown in jail and fined $5,000 for practicing medicine without a license. Meanwhile, in Washington State, I can prescribe drugs, deliver babies, perform minor surgeries, work in hospitals, order any diagnostic test I want, legally refer to myself as a physician, and it's all covered by insurance. Imagine that. We do not have a free medical market here in the United States, and the MD point of view is a stilted, old-fashioned, out-of-date point of view. You know, everybody's familiar with the story about how Galileo was locked up, thrown in prison, because he had the audacity to come out in public and say, hey, everybody, it's not the Earth that's at the center of the solar system, it's the sun. That seemed to be a revolutionary idea at the time, one that was not accepted by the mainstream. Science progresses one funeral at a time. There's a tremendous amount of inertia in the scientific community, and even more arrogance and even more hubris. The hubris the hubris personified by the MD profession is breathtaking. When any other profession fails, they look to themselves and try to make it better. When the MDs fail, they blame the patient. Lyme disease, for instance. When the standard conventional antibiotic treatment, which is usually a 2 to 4 to 8 week course of antibiotics for someone who has been potentially diagnosed with Lyme disease, when that fails, instead of calling it a treatment failure, the MDs make up a new syndrome. They call it, I forget the name of it off the top of my head, Lyme disease treatment incompatibility or something, right? It's not their problem, it's the patient's problem. It's a brand new disease. It's crazy. It's the only profession that we let get away with this. Now let's talk about asthma and allergies. 60 million people in the United States have asthma and allergies. 26 million have diabetes. 13 million have coronary heart disease. 12 million have cancer. 6 million have stroke, 5 million have Alzheimer's, and 5 million have Parkinson's. 60 million have asthma and allergies. And in our pediatric population, in the last 20 years, asthma has increased almost 30%. The incidence of allergies is rising in this country, and the MDs are looking for the genetic bullet, because that is their perspective. That is all that they know. On their watch, allergies are skyrocketing. It can't be their fault. It must be the patient's fault. It's got to be the gene. It must be the genes. It can't be our fault because we're gods. And yet, from the proper perspective, everything makes sense. The MDs have thrown the baby out with the bathwater because they do not recognize the importance, they do not recognize at all anything having to do with medical nutrition. And medical nutrition, in this case, has everything to do with the allergic condition. And even just elementary first-year pre-med anatomy and physiology and biochemistry would help people get a clue about this. Let me break it down for you. In the digestive tract of the human being, here's how it goes. We've got the mouth, we've got the teeth, we've got the saliva. You put food into your mouth, your teeth chew it up. It mixes with saliva. The saliva starts the digestive process that the teeth, or picks up the digestive process that the teeth have started, right? The whole process of digestion is to break the food down into smaller and smaller and smaller and smaller pieces so that the tiny, eeny-weeny, teeny pieces of food can filter through the intestinal tract and make it into your bloodstream, where then it's carried to the rest of the body for nutrition. So this process of making the food unit smaller starts with the mouth, in the teeth, and the saliva. And then you swallow the food. It dumps into your stomach, which is basically a great big bag of acid. There the food sits. And there are muscles in your stomach called smooth muscle. As a matter of fact, your entire intestinal tract is made from smooth muscle. The thing about smooth muscle is when it contracts, you don't feel it. You don't feel smooth muscle contracting. If you did, you'd be in pain all day long because your stomach is constantly moving and contracting and expanding and contracting and expanding, as are your intestines, to facilitate the process of digestion. It's mixing the food. The stomach's mixing the food with the acid. And the acid eats away at the food and makes it even smaller. And then once that job is done, the food leaves the stomach, goes through a little valve, enters the small intestine. Now, you've got 9 to 12 feet of small intestine, and it is the small intestine where everything gets absorbed into the bloodstream. The small intestine is populated with millions, with an M, of tissue called villi. The villi are like little octopus tentacles. And on the top of the villi are thousands of microvilli, leading to billions, with a B, of tissue in the intestinal tract. No exaggeration, billions, and that's a lot, of structures in the intestinal tract whose purpose is to absorb the small nutrients that your digestive tract has broken down and put them through into the bloodstream. That is the job of the intestinal villi, to absorb the nutrition that your digestive tract has broken down, absorb the food that your digestive tract has broken down into ever smaller pieces, so that it can then put those food units, those molecules of nutrition, vitamin B, vitamin A, protein, whatever it is, into the bloodstream where it feeds the body. Now, when these tiny molecules of nutrition, of food, digested food, pass through the villi, they enter the bloodstream. And when they enter the bloodstream, guess what they meet? Your immune system. Your immune system. Did you know that? The central headquarters for your immune system is in a network of blood vessels surrounding the small intestine like a pancake. It's called the greater omentum and the lesser omentum. It's this giant pancake of blood vessels, right? Millions of blood vessels in there just waiting to suck up anything that's passed through the intestinal villi. And just like when you go to Mexico or when you go to Canada, or when you leave the country, you pass customs when you go into the next country. You have to go through customs. Well, our immune system central headquarters, the customs department of the body, is right there in the network of blood vessels that overlaps your intestinal tract. So when that molecule of digested food passes through the intestinal villi and enters the bloodstream, it meets the immune system, which is the border guard. And if the food or whatever the molecule is okay, the immune system gives it a pass. If the immune system doesn't recognize the food that's passed through, it gives it a fail. And when it gives it a fail, a number of different things can happen, the result of which is stimulation of your immune system and the production of antibodies and the production of mast cells and the production of all of these things associated with allergies. So when you are eating food that damages the intestinal tract, which damages those little octopus-like villi, that's like punching holes through the border, through the gate, the fence at the border. So now big molecules of food slip through the holes in the gate and enter into the country. They sneak around security, they sneak around the border guard, they sneak around customs. But eventually, they're going to meet customs. And in the United States, in the human body, when a big molecule of food slips through that little crack in the intestinal tract where there should only be little molecules of food, when it gets into the bloodstream, it elicits an immune response. Which leads to one of life's greatest ironies, that the more of the wrong food that you eat, the more stimulated your immune system is, and this is the main cause of allergies. And you know the biggest food culprits that punch those holes in the intestinal tract? Wheat, barley, rye, and oats. Gee, there's been a 65% increase of wheat consumption in the last 40 years. I wonder if that has anything to do with allergies. To finish up on my allergy little riff here, this is the root cause of any allergy from the holistic perspective, the naturopathic medical perspective. Whether it's a seasonal allergy, an allergy to dust mites, and especially an allergy to food, is a facultative breakdown in the small intestine caused by consistent consumption of the gluten of wheat, barley, rye, and oats. So when a culture increases its consumption of wheat, barley, rye, and oats, one would therefore expect to see an increase in allergic conditions, number one, and number two, an increase in conditions associated with malnutrition, which are all chronic diseases have their roots in malnutrition, because the tissues that you're damaging by eating wheat, barley, rye, and oats are the very tissues that absorb the nutrients into the bloodstream. So if you damage them, you can't absorb as much nutrients. Remember, the food doesn't have as much nutrients as your body needs anyway. So if you damage the tissue that absorbs nutrition by eating wheat, barley, rye, and oats, it's like kicking somebody when they're down. It's going to make a bad situation worse, and then the MDs in their pathetic, colorblind, pea-brain scramble to find the next gene that regulates the allergic condition completely missed the boat. I mean, they have completely missed the boat. They have thrown the baby out with the bathwater. One more reason to completely fire your MD now, to just fire your MD now, is their ridiculous, old-fashioned, outdated, pathetic, juvenile understanding of even the basic, fundamental components of the allergic condition. It is laughable, especially to a holistic physician. And one more thing about the allergic condition. If you have allergies, and I don't care if it's a cat allergy or an allergy to roses, right? It doesn't matter. If you are allergic, here's what I want you to do. I want you to pay attention to when the next time, to each time that you have a flare-up of your allergic condition. Every time that your allergies flare up, instead of hunting for the pollen source, right, or looking for the aggravating, dust mite, right, looking for the dust cloud somewhere, instead of that, I want you to make a little list of everything that you just had to eat or drink within the last 30 minutes, everything that you just ate or drank. I don't care if it was a stick of gum. Write it down. By the third or the fourth time that you've had an allergy attack, you're going to have a long list, and you'll be able to cross-reference the foods that you ate that were similar for each allergy attack. And when you do this, you're going to find that there's some category of food, or maybe one or two categories of foods, that are in each list. Those foods would be considered triggers for your allergic condition. And now most of the time, this is not, it's not set in stone. Most of the time, the foods that trigger an allergic attack in an acute phase have sugar in them, especially honey. But it can be anything, right? It can be a strawberry, it can be a piece of bread, it can be butter, it can be anything. So when you keep a running list like this, you will be able to target the foods or drinks that trigger your allergies, right? And then by simply removing those foods from your dietary intake during allergy season, or when you're around a known allergen, it's going to significantly cut down your experience of your allergies. As you're moving forward with a gluten-free diet, which will, just by virtue of the fact that you're stopping picking the scab, you're stopping irritating the tissue, just by removing gluten from your diet, the allergies will get better every year. They have to, because your intestinal tract will be healing. Now, if you add the gluten-free diet to the bad food diet, right, that you can download for free at drglidden.com, 10 bad foods that nobody should eat. When you remove those 10 foods and nutrify your body, you're going to remarkably improve and increase your body's recovery time. Your allergic response is going to be dampened down. Life is going to be good. And one of my favorite add-on products to the 90 essential nutrients for people who are suffering with allergies is a product called Cell Shield RTQ. Cell Shield RTQ. The Q in that product stands for a biochemical called quercetin. And quercetin is a natural antihistamine. It doesn't flag out your immune system like antihistamines do. And if you are suffering from allergies and you take the Cell Shield RTQ, you're going to love how it makes you feel, because it's going to dampen down the symptomatic expression of your illness while you're giving your body a chance to heal. This is our game, ladies and gentlemen. Heal it. Don't paint it over. Don't suppress it. Our game is to fix it. Hey, everybody, welcome back. Dr. Peter Glidden, where it's my contention that if you're not angry, you're just not paying attention. Really, we've taken the wrong dog to the hunt. We've put our trust in the wrong system of medicine. My recommendation, cancel your comprehensive medical insurance. Buy catastrophic medical insurance instead, and use the money that you save to purchase nutritional supplements, educate yourself about health, change your diet. You can change your diet and educate yourself, or changing your diet's free. Educating yourself about your health is $5 a month at fireyourmdnow.com. Fireyourmdnow.com. Purchase a subscription to my webinar series. You can purchase it monthly. You can purchase it yearly. You can go for it. Knowledge is power. There are only a handful of physicians that are aware of this information. And if you come to a longevity event, if you come to a lecture that I give, I just gave a lecture last weekend in Milwaukee. This weekend I'm going to Trinidad to give a health lecture. The weekend after that I'll be in Greenville, North Carolina. Then it's off to New Hampshire. I'm all over the place all the time in my webinars, or you can see them from the comfort of your home. Knowledge is power. Lift yourself up into knowledge, because when you visit an MD, you're going down the tubes, baby, unless you're bleeding to death. And I'm going to go right to the phones here. There's a nice little segue with Glenn, who's calling in about a question about his appendix, and I'm going to tell you what that segue is now. Glenn, you're live with Dr. Glidden. Thanks for calling.
Yeah, how you doing, sir? I'm not going to talk to you about coconut oil today. But I'm kind of worried about myself. I'm 64, and I've noticed there's two things. I've noticed Dr. Wallach speak of appendix. He always asks people, have you had the appendix removed? Have you suffered from bronchitis? Well, I had my appendix removed from a small child as a result of an emergency operation because the appendix had ruptured. And also had my tonsil removed, and I suffer from chronic bronchitis. So I was kind of concerned about that. I wonder why he asked all his callers those questions.
Oh, that's simple, Glenn. That's a good question. That's easy to answer. There's a saying, two sayings in medicine. Well, one saying is from medicine, one is just from life. The one from life is, where there's smoke, there's fire. And the other is, healing is easy. The thing about where there's smoke, there's fire is, and the reason that Dr. Wallach asks these questions is because most of us in the United States eat wheat, barley, rye, and oats just as a normal part of our life. I mean, we think it's healthy, right? We've been brainwashed by the food industry to think that whole grains are like, the second coming of Christ, and it's the best thing that the human body could possibly eat is a whole grain, Start your breakfast off, with healthy whole grains. And irony of ironies, whole grains are among the worst foods we can eat because they damage the intestinal tract. The gluten in the whole grains damages the intestinal tract. And as I talked about in the first segment, the part of the intestinal tract that gets damaged is the very tissue that absorbs nutrients. Now, when this condition progresses, one of the things that it generates frequently is chronic constipation, chronic gastrointestinal symptoms. There's something going on with the gut, and or acute appendicitis. And this is what we talk about, where there's smoke, there's fire. So most of the time, and there's another one of my favorite sayings in medicine, that when you hear hoofbeats, you think about horses before you think about zebras. So when we see symptoms, or have a person with a presenting history of symptoms, we think about the things that are most commonly associated with that presentation before we start thinking about weird stuff. So most of the time, people that suffer from appendicitis, the problem isn't anything genetic, and it isn't anything, structurally problematic with the anatomy of the appendix itself, like it got contorted through birth or something, or it's, a weird anatomical variant. The problem is that person has a sensitivity to wheat, barley, rye, and oats. So we use a history of appendicitis to give us a clue as to how bad that person's digestive tract has been hurt by wheat, barley, rye, and oats. It's a from-the-hip diagnosis, but most of the time it rings true. So anybody listening here in Radioland, if you don't have your appendix anymore, and it was removed for a medical reason rather than your doctor just figured out, he'd make a couple of $1,000 by removing your appendix because MDs think you don't need your appendix, that it's a vestige, some evolutionary vestige, like a tail that fell off in the monkeys. And I'll tell you why we need the appendix in a minute. If you had your appendix removed because of a medical emergency or some type of condition, that was generating pain in your body or inflammation, then odds are that you have an intolerance to wheat, barley, rye, and oats, and you shouldn't even look at wheat, barley, rye, and oats, let alone eat it. So that's why Dr. Wallach asks this, because we're looking to see, we're kind of hunting. We're looking through the binoculars at the horizon for the smoke that's coming up when we talk to people over the phone, in order to kind of dial in down and dirty status quo of their anatomy and physiology. So let that be a word to the wise, Glenn. If you had your appendix removed at a young age, then from a young age, you, my friend, have had a problem with wheat, barley, rye, and oats. And the sooner you stop eating that stuff, the better you're going to be. Does that make sense?
2 months.
Okay.
And yeah. I've been on a gluten-free diet for 4 weeks.
Yeah,
and I asked Dr. Wallach, I said, well, why is it when I look at my stool, I see red color? And he said, well, that's a sign of you're not absorbing. So I'm kind of worried whether or not I'll be able to get any benefit at this age. I've been eating trillions of tons of wheat, and old all my life.
Well,
So
yeah, all right. So, worry is irrelevant in this regard. It's good to be concerned. I get where you're coming from, though, but here's the deal. Continuing to eat that stuff is going to continue to damage your body. So you need to stop eating it, number one. Whether your body will be able to recover or not is anybody's guess, but the fact that you're still alive means that your body is still absorbing nutrients. If your intestinal tract was completely debilitated, you'd be dead because your body wouldn't be able to absorb any nutrition. That's like a car that has a gasoline tank that's got a giant hole in it. There's no more gas in the tank. The car can't go. No matter how much you put in through the side, through the nozzle, it's going to just leak right out the bottom. Well, if that was the case with you, you'd be dead. You're not dead. You're alive. And so, number one, we need to stop eating food that's hurting us, number one. And number two, lean on the fundamental holistic belief that the human body has a great resiliency. And your body wants to fix itself. It wants to fix itself. Oftentimes, the only reason that it does not fix itself is because it doesn't have the proper raw materials that it needs to fix itself. And so this is why we supplement with the 90 essential nutrients and extra add-ons. Now, so don't worry. Just take the supplements, change your diet, and see what happens. And by the way, if you've been gluten-free for 4 weeks, you're at a friend's house or you're at a barbecue or you're at a party, you're out to eat somewhere, and all they have is something that has gluten in it. When you've been away from gluten for a number of weeks and then you throw gluten back into your diet, man, you're going to feel like crap. And if you feel like crap when you throw gluten back into the diet, then life is good. Life is good, Glenn, because you're going to know that your body still has resiliency and it's still hanging in there, baby. So 2 things that you might want to consider in order to facilitate the healing of the gastrointestinal tract would be the Flora FX. The Flora FX, if you take 2 of those before bed every night, that gives the beneficial bacteria to your intestinal tract. That will facilitate healing, as will the add-on of a liquid supplement called Maqui Plus, MAQUI Plus, and that was my supplement of the week last week, the Maqui Plus. It's aloe vera, which is very, very healing to the intestinal tract, and mackey berry, which is loaded with antioxidants. That stuff's like never fail fudge for people that have a problem with their GI tract. So, if it's in the budget, get some Maqui Plus and start taking it, or some Flora FX. But for whatever else you do, Glenn, stay on the gluten-free diet and continue to take the 90 essential nutrients. You're going to love how you feel. Thanks for calling. We're going to go right now to Jeff, who has a question about type 2 diabetes. Welcome aboard, Jeff. You're live with Dr. Glidden.
All right. Yeah, I've got. It's actually type 1 diabetes. I have
okay. Very good.
Type 1 diabetes. I've had it since 1985. On insulin pump, did like 6 shots a day for 20 years.
Yeah.
But manage it real well. I'm very. I'm a fitness fanatic. I do like amateur bike racing. Yeah. But I'd really love to get off it.
Okay, well, here's the deal. Let me give you the rundown for this. And last Saturday in Milwaukee, I went up and gave a lecture for a couple of hours to about 120 people. And one of the people in my entourage that made the trip with me was a young man from Chicago. His first name is David, and he's going to Loyola University now as a pre-med student. And he's become... he's mentoring with me for the last couple of years because he's really into it. Now, he's a type 1 diabetic, and of course, one of the benefits of conventional medicine was the discovery of insulin, and type 1 diabetics without insulin would die.
Right.
So, that's a good thing. That's one of the good things that the MDs have done, right? They've been able to develop this program. Now, I'll tell you this kid's story. Before he got on board with medical nutrition, he was taking 250, I believe, units of insulin a day, 250 units of insulin a day. And 3 weeks after he started Just one supplement. He couldn't afford, he's a college student. When I met him, he was a high school student. He couldn't afford the 90 essential nutrients. Couldn't do that. All he could afford was one bottle of a product that Dr. Wallach developed called Sweeties, which delivers a lot of the minerals that your body needs to metabolize blood sugars efficiently. So it's all he could take. It was one bottle, $24 a month. Now, this kid weighs about 135 pounds, soaking wet. And within 3 weeks, he was able to reduce his insulin down to 25 units a day. 25 units a day. Because this supplement supports and promotes the body's effective use of and metabolism of blood sugar, and it's a great thing. So now one more thing I want to touch on here, and we might run out of time. If we do run out of time, I'll pick this up on the other side of the break, okay? So stick with me. Type 1 diabetes, of course, is caused because the beta cells in your pancreas have burned out. Your body can't make any more insulin. Type 2 diabetes is also called insulin resistance syndrome. That can develop in anybody, whether they're type 1 diabetic or not, because the problem there is the insulin that is in your blood, you're injecting it, and anybody else, their body could make it. The insulin that's there doesn't get into the cells the way that nature intended it to. So it lingers in the blood and can't get into the cell and open the sugar gates on the cell. This is called insulin resistance. Anybody can develop insulin resistance. Insulin resistance is a multiple mineral deficiency, just like scurvy is a vitamin C deficiency. Rickets is a vitamin D, like David, deficiency. So my point here, Jeff, is that anybody with any type of a diabetic condition will only benefit from the therapeutic application of medical nutrition, which will, by definition, increase your body's efficiency at absorbing sugar. And ladies and gentlemen, we're talking to Jeff, who has type 1 diabetes. So what we do, Jeff, in this fashion, in order to keep type 1 from going into type 2, and in order to make your body more efficient at being able to metabolize its sugars, is one healthy blood sugar pack. Imagine that, right? We made it easy. Because remember, man, again, I cannot emphasize this enough. We've been brainwashed on two fronts here. Number one, we've been brainwashed to believe that the MD is the undisputed king of medicine and everybody else is a back-of-the-bus quack. It's just not true. Number two, we've been brainwashed to believe that healing is some complicated, mysterious process. It's not. Surgery is. You better have medical training if you're going to try to pull a bullet out of somebody's arm, but healing is easy. So guess what? We have healthy bone and joint pack, right? We have healthy brain and heart pack, and guess what those are for? We have a healthy blood sugar pack. It's that simple. So the recommendation is one healthy blood sugar pack plus one bottle of plant-derived minerals plus 2 bottles of ultimate selenium per 100 pounds of body weight per month. Now, if you're, 150 pounds, you can't buy half a pack, so you buy 2 packs in June and 1 pack in July, and you dose it like that. So that's all that you do. And, if you can't afford the full boat, then knock the selenium off, and then if that's still a little too high, knock the plant-derived minerals off. If you're 200 pounds, you can only afford the 100-pound dose, do that. If the budget's really tight, like it was for my little student, David, then just get 1 bottle of a product called Sweeties, 1 bottle of the Sweeties. That's $24 a month. So that's what you need to do, plus the good food, bad food diet. Especially, man, if you are an exercise guy, because exertion increases your metabolism, and increased metabolism demands more nutrition, because what do you do when you exercise? You break tissue down, you break your body down, and then post-exercise, in a perfect world, your body tries to fix and rebuild and strengthen itself, but guess what it needs to fix, rebuild, and strengthen itself? It needs nutrients, right? It needs nutrients. So when you exercise and take the Healthy Start Pack, you're going to feel like Superman, no kidding. And we even developed, for the serious weekend warrior, our version of Healthy Gatorade. It's called Rebound FX. We developed that with Theo Ratliff of the LA Lakers. He's retired now. It took 3 years of research and development with Theo, working back and forth to come up with the perfect blend of nutrients to take during, before, during, and after a workout or a sports event. And one of the things Theo was known for, and I interviewed him about a month ago in this radio program, one of the things he was known for was his endurance. You know, in the third period of the basketball game, he's good to go. He's 10 years older than everybody else on the team. He's running circles around him because he was the only one on the team drinking this stuff. Well, not for long. There's a very famous basketball player, just retired, a big guy. We can't tell you what his name was, but he would drink this stuff on the court. They made him put it in a Gatorade bottle. Gatorade had a big contract with this team. They made him put it in a Gatorade bottle. They said, we don't care what you drink as long as it's in a Gatorade bottle. So the proof of the pudding is in the eating here. When you take these supplements, especially if you're a type 1 diabetic and you're already, because your life depends on it, in the habit of measuring your blood sugar levels, you're going to be amazed at how much less insulin you'll need to deliver the same results with energy as you go down the road with this program. Does that make sense, Jeff?
Yeah, I got a question for you because I'm already, I've been doing the rebound for about a year and a half. I've gotten a Healthy Start Pack and the selenium, and I take a glucogel. So the Healthy Blood Sugar Pack, is that just kind of adding the sweeties to it?
Yeah, that's right. The only addition there would be the sweeties. And the Healthy Start Pack all by itself is light in the mineral department. One Healthy Start Pack for a 100-pound person only delivers about half of the minerals that you need. So I add to every Healthy Start Pack, just by definition, one bottle of liquid plant minerals. It's only $19. So if you add the liquid plant minerals and the sweeties to what you're already taking, within 4 weeks, you will recognize a diminution in your blood sugar. So give that a try and give me a call back with a report. I'd love to be able to broadcast this to the community. Thanks for your call. We're out of time, regretfully. Ladies and gentlemen, I'm Dr. Peter Glidden. Thank you so much for your call. If you'd like support when we're not online live, call us 855-347-3696. I'll see you tomorrow.